Rapamycin vs. other drugs. A balanced analysis of long-term use and safety. Rapamycin, a drug widely recognized for its potential in extending lifespan and preventing age-related diseases, often faces scrutiny due to concerns about its side effects. However, when we compare it to other commonly used drugs, such as aspirin, we find that rapamycin may not be as dangerous as it is sometimes portrayed, especially when used properly. In fact, when administered at appropriate doses, rapamycin could be as safe as, or even safer than, aspirin, a drug that millions of people take every day despite its known risks. Comparing the safety of rapamycin and aspirin. Aspirin, one of the most commonly used non-prescription medications, is known to carry a range of potential side effects, some of which are life-threatening. These include severe gastric bleeding, ringing in the ears, confusion, hallucinations, seizures, and even coughing up blood. Despite these risks, people continue to use aspirin daily to reduce the chances of cardiovascular disease and cancer. Why? Because studies have demonstrated that, for most users, the benefits of taking aspirin outweigh the risks. Similarly, rapamycin offers significant benefits, particularly as an anti-aging agent. Its ability to inhibit the mTOR pathway, a crucial regulator of cell growth and aging, has been linked to longer lifespans in animal studies and the prevention of age-related diseases in humans. The side effects of rapamycin, especially when used at low or intermittent doses, are relatively mild compared to the significant health benefits it provides. Reassessing rapamycin's side effects. Many of the concerns about rapamycin stem from studies in cancer and transplant patients, where the drug is often administered at high doses and in combination with other medications. Under these circumstances, some side effects, such as fatigue, low blood cell counts, and mouth ulcers, have been observed. However, these effects are often exaggerated or incorrectly attributed to rapamycin, as many studies lacked a proper placebo group for comparison. In fact, in placebo-controlled studies involving healthy elderly volunteers, no significant side effects were reported among those taking rapamycin compared to those on a placebo. Even in studies where mild side effects such as thrombocytopenia, a low platelet count, were noted, these effects were reversible and non-severe. Moreover, some of these side effects could actually be beneficial. For instance, a slight reduction in platelet function is one of the intended effects of aspirin to prevent blood clots. At higher doses, rapamycin and its analog, everolimus, can slow down cell proliferation, leading to reversible reductions in blood cell counts, including thrombocytopenia, anemia, and leukopenia. However, these effects are generally mild and manageable. The exaggeration of rapamycin's risks. One major reason why the side effects of rapamycin are often overstated is that many studies estimating its risks were conducted without a placebo group. This has led to confusion between the drug's effects and the symptoms of the underlying diseases it is used to treat, such as cancer or organ transplant complications. For instance, side effects like fatigue, asthenia, are often attributed to rapamycin, but are just as likely to result from the disease itself or other concurrent treatments. In one placebo-controlled study, healthy volunteers on a placebo reported more side effects than those taking rapamycin. This highlights how some of the concerns around rapamycin's side effects may be psychological or due to the underlying conditions in the study population, rather than the drug itself. Side effects of rapamycin at high doses. How relevant are they? At high doses, Rapamycin can cause specific side effects, such as stomatitis, inflammation and ulcers in the mouth, and non-infectious interstitial pneumonitis, a lung condition. It can also impair neutrophil function, potentially increasing susceptibility to bacterial infections. However, these side effects are typically seen in cancer or transplant patients taking high doses of the drug over extended periods. For those using rapamycin for anti-aging purposes, these high-dose, chronic regimens are not necessary. To minimize risks, rapamycin can be used intermittently, e.g., once a week, or at low daily doses. This method of administration reduces the likelihood of side effects while still providing the drug's anti-aging benefits. If any unpleasant effects do occur, rapamycin can simply be discontinued without long-term harm. The case for rapamycin's safety in long-term use. In conclusion, rapamycin, when used properly, appears to be no more dangerous than many commonly used drugs like aspirin, which is widely accepted despite its known risks. While rapamycin's side effects have been a point of concern, particularly in high-dose, long-term use in cancer and transplant patients, these effects are largely manageable, reversible, and, importantly, much less frequent in healthy individuals using the drug at lower, intermittent doses. The benefits of rapamycin, particularly in terms of extending lifespan and preventing age-related diseases, likely far outweigh the risks when used correctly. With careful monitoring and appropriate dosing, rapamycin offers a promising option for improving health span and potentially increasing longevity in humans. Like aspirin, its risks must be considered, but the overall picture suggests that it can be safely integrated into medical practice for those seeking to combat the effects of aging.